Stephen Medearis. I'm a second year at Tulane Medical School. I worked with Dr. Mary Mulcahy and others, orthopedic surgeon Dr. Mary Mulcahy, to do a systematic review looking at open medial opening wedge high tibial osteotomy and whether or not, or the role and function of the bone void fillers. So medial opening wedge high tibial osteotomy is a treatment for, or a surgery for severe varus de-alignment, so bow-legged knees. What they do is they cut into the medial proximal tibia and realign your knee to fix the alignment. There's a lot of different thoughts on how you can fill the bone after you cut into the tibia. There's 4 different options, and historically it was thought that the gold standard was an autograft from the iliac crest. But there's also an option for a synthetic bone filler, an allograft, and leaving the opening completely unfilled. An allograft has added risk of infection, while synthetic may add to worse outcomes. There was a study done in 2016, a systematic review looking at this same indication, and what they found was 14% of this surgery was done without no filler, and they had similar, if not better, outcomes when the gap was less than 10 millimeters. So what we did is we looked at 24 different studies, and we found that since that time, 41% of surgeries are now done without any type of filler. And we found that under 10 millimeters, there was only 1 instance of non-union or loss of correction. When compared to the other 3 different types, there was a significant decrease with no bone filler. And so as part of our conclusion, we found that, or we suggested that this procedure may have added costs without any functional benefit in using any other type of filler, and particularly under 10 millimeters, you do not need to use a filler. And I think that's it. I wanted to thank everyone for having me. I was considering not coming, and I'm glad I made the trip from New Orleans. It's been nice meeting you all. Any questions?
I might have missed it, but are there discrepancies and complications between filler and no filler?
Yeah, so what we found is under 10 millimeters, there were 200 different patients that had this procedure done, and only 1 instance of loss of correction or non-union. There's another 1,000 patients that fall under the category of allogenous, autograft, or synthetic, and they had 2%, so a significant